Hi, everyone. Welcome to the podcast, The Reality of Plastic Surgery. I am Dr. Aftab Siddiqui. I'm a consultant plastic surgeon in Manchester. In this episode, I'll be talking about the tummy tuck operation. More specifically, who is a good candidate for a tummy tuck procedure? So, what is a tummy tuck? This is a common term for an operation on the abdomen where we go and take out the excess skin. We do the tightening of the six-pack muscles, and sometimes we do a liposuction on the tummy to improve and give a better contour. This is one of the most popular cosmetic operations at the moment. It is very important to understand who is the right candidate, who is a good candidate. Everybody will not get a good outcome from a tummy tuck operation. So if somebody is considering this procedure, he or she needs to make sure he is going to benefit from a big operation and he is going to be happy with the outcome. So we will be discussing today this part of this procedure. Most important, somebody who is considering this, he or she should be physically healthy. So it's a major operation. It will involve a general anesthetic. It could be 2 to 3 hours operation. So you have to be physically very healthy to undergo this operation. So you make a good recovery from the anesthetic, you have good wound healing, and you have a good result. Second most important thing I would say is that you should have a stable weight. Ideally, your weight should be stable for last 6 to 12 months. Then you can consider this operation. If somebody is still trying to lose weight or you have not achieved your target weight, then this operation is not good for you because you will end up getting this operation, and when you lose weight, you will end up with not a good result. You will have some loose skin contour deformities, so it will not achieve the desired result. Third most important thing is that a person looking for this procedure, he or she should have some realistic expectations from this surgery. So this surgery is to improve the contour of your tummy or the abdominal wall. This is not a weight loss operation. So somebody who is planning to get this operation to lose weight, he or she will not be happy with the results of this operation. And this operation will mainly address the excess skin in the tummy. In addition, there will be some muscle tightening, so that will help the tummy to go flatter. And in addition, if you go for some liposuction, that will give you a better result. It should be very clear that this operation does not address anything inside the tummy. So it doesn't deal with any fat inside the tummy. It only addresses all the tissues outside your tummy muscle. Anybody who is considering this operation, you should be non-smoker, or you should have stopped smoking for a good period of time, minimum of 6 weeks to 3 months. If somebody is smoking or taking tobacco or nicotine in any form, it's likely to give you problems after the operation. You will be at a higher risk of complications during the procedure. The wound healing will be delayed. There'll be more complications. So somebody who is a smoker, you are not a good candidate for this operation. Other important thing is somebody who is bothered by the appearance of the abdomen. They are more likely to get a good result. If somebody has got minimal of excess skin, it's not bothering you, then this operation is not going to give you your desired result. You are not going to get a good outcome. So somebody who has concerns with the appearance of the abdomen, they can talk to the surgeon, see what procedure can be done and what results to expect. Other important things to consider: your suitability or fitness for this surgery is that you should not have other medical conditions which affect wound healing, recovery, or which puts you at a higher risk of complications. You should also inform your surgeon about all the medications you take. So there are some medications which make you bleed more, so they will be putting you at a higher risk of complications. So it's very important to discuss all your medications with your surgeon, and so that you know, and so that you can come to an agreement that this is the right operation for you. Generally, you should refrain from drinking alcohol a couple of days to weeks before surgery. Also, somebody who had multiple previous operations, they are not ideal candidate for these operations, because previous surgeries can give you a lot of scar tissues. They can make you bleed more and leading to more complications. If you are considering this treatment, you should discuss all your health conditions with your surgeon. You should disclose all your pre-existing health conditions, and the surgeon will evaluate all the risk factors. So he will discuss all the options of this treatment, like what are the different types of tummy tucks available, which ones are good for you, which ones are going to give you your desired results, and surgeon will be able to discuss with you what are the outcomes of the procedure, what are the downtimes, and what results to expect. He will also be providing you some leaflets which will be having all the details of the procedure, all the risks, the complications, the downtime, recovery, and you return to work. He will be also be discussing your driving, your exercise, and other normal activities before you make plans for any surgery. Details of these issues are available on my website.